Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Podcast Studio, and we are super excited to have Stephanie Martin on our podcast to talk about her wellness journey and how she teaches yoga and nutrition now. So, Stephanie, welcome to our show.
Hello, nice to see you both.
Yes, it was so good to meet you a couple weeks ago, I guess, in Tampa when we were at the
Hack Your Health.
Hack Your Health.
Hack Your Health. Yeah, I couldn't think about it.
And the Healing Humanity dinner.
Yeah, we went to a Healing Humanity event where we talked everything carnivore and ate everything carnivore. So you were talking a little bit about your health journey then. Tell us your health journey and how you got into teaching people about wellness.
Well, that goes back a long time now. So I guess you could say that my health started to become problematic. Like, I was never a sickly child, but whenever I was in 5th grade, I woke up one morning and I was just covered in like what we thought was like acne, like all over like my forehead and my chest and my back. And my mom, took me to the dermatologist, and he just thought that, okay, puberty's starting and, it's just hormonal. And so that was like the first, like, what the heck moment, because it just came on so quickly. And then fast forward, going into middle school and high school, I started having a lot of digestive type of issues, like all the things that go along with, upset stomach. And I went to, and the skin issue was still prevalent, like, which we thought was acne. And so I was put on to tetracycline and birth control pills to help with my skin. And I guess it helped a little bit, enough to keep doing it, because I ended up being on those antibiotics for about 2 years. And the birth control pills for even longer than that. And, the stomach issues, still everything just wasn't quite right. I was athletic, and I would say, other than the skin issues and the stomach issues, I was very active, very fit. I went to the University of South Florida, and I was majoring in what they called at the time wellness leadership. Now it's called exercise science. So I was big into the fitness part of the health industry at that time: personal training, cardiac rehab, fitness testing, stuff like that. And I was 21 years old, and I was still living at home because I commuted to school every day. And I woke up on Mother's Day of 1993 and could hardly move and get out of bed. Every single joint in my body, places you don't even know you have connective tissue, everything was swollen, it hurt, sore, red. And I hobbled down the hall and I told my mom, I said, "Happy Mother's Day, Mom." I said, "I don't feel good." And, she's like, "Oh, you're doing too much. You're working out too much." I was a full-time student. I was a part-time waitress. I was engaged to be married. Like, there was a lot going on. And so this started a 4-year odyssey of going to the doctor every single week, having blood drawn every single week. The symptoms got worse, more severe. My knuckles were like almost triple the normal size. Could not bend them, couldn't bend my knees. I walked like Frankenstein. I was getting vasculitis welts all over my body, hair falling out. I was always thin, but I lost weight. And then I was in the shower and my lymph nodes in my groin looked like clusters of grapes. Like, they had swollen up gigantic, and it scared me. I've never seen anything like that. So my mom takes me back to the doctor, and long story short, they send me to an oncologist because they suspect that I could have lymphoma. So I had 2 lymph nodes removed, and they tested them, and thank God, it was benign, but it's a mystery. Like, what is going on with me? So it was, they checked me for Epstein-Barr. They checked for rheumatoid arthritis, Lyme disease. I was checked for so many things and they could never pinpoint really what it could be. I did have a positive ANA and they said, oh, well, it's autoimmune. And even though I didn't have all of the typical symptoms, they ended up, because of insurance purposes, they said I had lupus. So I was put on to methotrexate, prednisone, Plaquenil, and 800 milligrams of Motrin every day. And that was for like 4 years. And as you guys know, when some of those medications like chemotherapy drugs and Plaquenil messes with your eyes, you have to get them checked all the time. And so it was an absolute nightmare. I hadn't had a period, because they put me on birth control pills. And I mean, that was a mess. And they told me that, you're probably never going to get pregnant. And we don't recommend that you ever try to have a baby, because I was really deathly ill by this point. I mean, so much so I was put on the prayer list at church because I thought I was dying. People thought I was dying. It was just horrible. I was really close to being in a wheelchair because I could barely stand up and walk because I was just so inflamed and swollen. And by an absolute miracle of God, I did end up getting married and I did get pregnant, which was honestly to this day one of the biggest miracles ever. It was totally unforeseen. And I remember my son was probably about 6 months old. And I started, because when I was pregnant, I actually felt a little bit better. They had me on prednisone the entire pregnancy, intravenous prednisone during labor and delivery and afterwards. And then I started feeling worse again. And I thought, oh no, here I'm a new mother and might not be here for long. So out of desperation, I was a total needle phobe. Like I did not want anything to do with needles because I mean, I had been poked and prodded so much in those 4 years. But out of desperation, I went to an acupuncturist. She was an acupuncturist. She was actually an RN also, and she did herbs and stuff I didn't even hear about at that time. But I was so desperate, and all I know is that they just kept giving me medications. I'd have to just show up. They'd move around my joints, give me another prescription for more medication. No one was trying to answer the question, what is going on? What created this? They just kept giving me the medicine to try to, make the symptoms go away, which, I mean, that's fine and dandy, but I'd kind of like to know what the problem is so I can fix it. And so just to shorten this whole part of the saga, I remember laying on the table in this lady's back room, and she put an eye pillow over my eyes, but I can kind of see down like between my nose and, where the eye pillow was. And she was shining lights up my body. Like she put in the acupuncture needles and then she was shining lights. I now know that that's color therapy, but back then that was the biggest woo-woo. Like I didn't know what it was. And all I can tell you is that after 4 visits with this lady, something, I call it the voice that's in my head, that inner intuition, and it said, you're just going to come off this medicine. So I quit all my medicine with the exception of the prednisone because I knew I couldn't come off of that cold turkey. And I took those prednisone pills and I cut a quarter out. So every week and a half or so, I'd cut out another quarter. I don't know if I did it right or not. I'm not telling anybody else to do that, but that's what I did because none of my doctors, and I was seeing rheumatologists, oncologists. I mean, I saw all the specialists, all the IST I saw, and they didn't want me to go off the medicine. They said it's preventative, so you don't get worse. Long story short, I just went ahead and went off the medications. I weaned myself off the prednisone, and it has been 28 years, and I have not been on one pill for one thing in 28 years. So ultimately ended up going back to school, got my nutrition degree, and I just figured out that I test negative for celiac, but I have severe non-gluten or non-celiac gluten sensitivity. And so, and I'm Italian. So you tell an Italian you can't have bread and pasta and all of that. I mean, it was a big lifestyle change. It was a choice I had to make. And when I was like, I'm one of those people where if I believe in something, like it feels good within me. I mean, I'll try it if you're desperate enough and you want to be well. So I did. I gave up the gluten, and I kid you not, in the first 2 days, it was like the first time in years that I didn't have cramps and bloating and like all those stomach issues. Every single morning, my stomach hurt. I'd be doubled over in the aisles of the grocery store, like, and I could not figure out what was going on. Well, it turns out it was that big bowl of healthy cereal that I was eating every morning, and it was just wrecking me. Because when I was in college, they were teaching still off of the food pyramid in my plate. And the food pyramid was probably one of the biggest travesties ever to happen to the public. And so I thought fat was the devil and red meat was going to kill me. And I had to eat a bunch of carbs. And I mean, really, honestly, it messed up my mind, because I became so, when you don't feel good, but you're trying to do the right thing, what the professionals are telling you to do, listening to the government guidelines, the American Medical Association, and you just feel worse. I mean, it really just, it just, you feel distraught. And so once I realized that, the food pyramid kind of a scam, not kind of, it is. And so what I have fast forward all these years and being on that journey and now helping people for, well over 25 years, is that carbs really create a lot of problems. And the way that they're processed, the glyphosate that they're sprayed with, I mean, there's a lot of parts to why they're so bad, but that's what's created all this obesity and diabetes and Alzheimer's and you name the degenerative inflammatory disease. And usually it's built on a foundation of an inflamed body due to the amount of carbohydrates that have been consumed. And people assume that if it's in the grocery store, it's legal, it must be okay for you to eat. And so people, and it's usually cheap. Wheat's a commodity crop. So a lot of people, they just don't know. And that's what I really try to focus on in my work now, is I want to be more, I don't want to just tell people what to do. I try to educate them as to why they need to make the change and how that's actually affecting their physiology. Another aside, besides the physical stuff, my family is full of heart disease, cancer, thyroid issues, you name it, it's in my family on one side or the other. But on my dad's side of the family, there's a lot of Alzheimer's. So that really got my attention as well. And whenever I saw how the same things that are creating the obesity and the diabetes and all these inflammatory conditions, it's like Alzheimer's, they call it a diabetes type 3. So it all interconnects, which gives me even more determination, hopefully, to do everything in my power for me not to go down that path. But I want to help other people not suffer. So that's kind of where I am now, is just trying to help people wake up and understand that what they're doing could really be damaging their body, their mind, their spirit, because it gets you down. I mean, you don't feel good and then you get depressed.
Stephanie, did any doctor ever ask you once about your diet during your journey?
I can tell you 100% over all the years and all the specialists and all the people that wrote the books and everybody I went to, not one time did anybody say, could it be something you're eating? Could it be something you were exposed to?
Right.
Not once. Honestly, I can say I'm the one that ended up healing me when I found out how gluten had just destroyed the gut, the small intestine. Even though it wasn't celiac, it was doing the symptomology was exactly the same. I just didn't have the antibody test positive. But no, ma'am, not one person ever said it could be something that you're eating. And remember when I told you at the beginning that when I was in 5th grade, I woke up and I was covered in, okay. Well, it turns out that you might remember this, back in the day, there was Fabergé Organics Wheat and Honey shampoo that was on the market.
Yes,
Doesn't that sound okay? Well, the gluten that was from the wheat, I think that's what they now said. That makes total sense.
Right.
Usually we see an exacerbation of symptoms as people approach puberty, because with the changing of hormones, it seems to set off a cascade of worsening symptoms. And so I guess it was like the perfect storm. My mom bought the Fabergé Organic Wheat and Honey because, boy, that sounded healthy. And it set off a lifetime of skin issues. And then, as I'm sure you guys know, anytime that your gut, your digestive system is affected and inflamed, that automatically is going to be like a skin condition. Some people it's acne-like, sometimes it's like psoriasis or, eczema. And we know eczema and asthma, even though I never had any asthma type symptoms, but I usually when I see someone present with eczema, there's usually asthma. Very common in children. Asthma and eczema just go together. And so, I look back now and it's like everything kind of makes sense. Like I understand that I had a sensitivity toward that as a child. And then following the food pyramid in my formative years, I just made a bad situation worse. And it wasn't until I did the exact opposite of what we were told to do that things started to get better. So yeah, it's kind of funny when hindsight's always 20/20, but
well,
yeah,
I'm glad you made the changes, Stephanie. And I gotta wonder, I mean, seriously, with all the meds, being pharmacists, we know those medications. With all the meds that you were on, I wonder if you'd still be here with us today if you were going the traditional route. I mean, they probably would have killed you. And
I often think that, and I've told my parents that. I said, if I would have listened to the doctors, one, I probably would not be here by now, or I would be so sick and infirmed, probably would have never had my second son. So I guess I ended up having 2 healthy children. They're 28 and 24 years old and doing great. But I mean, yeah, I often think that if I did not have, you can call it inspiration, desperation, to try something alternative, that you're absolutely correct. I mean, I remember when I wanted to try to have a second baby, I went to the rheumatologist. Now, I had taken myself off all that medication, but I was still a little scared to this time. The first time I got pregnant, it was miraculous. Like, I never thought it was possible. The second time, I thought, I want to be really smart and wise about this. So I went into the rheumatologist. They ran the blood work, ANA, still positive. And he said, you really need to go on Plaquenil. And I said, what for? Because I was feeling so much better. And he said, for prevention. And I left there and I thought, there's no way. I'm doing so much better. I feel so much better. And I got pregnant. I went ahead and I did it. I trusted in myself and my intuition and God. And I got pregnant within 3 or 4 months of trying, and perfectly healthy child. So yes, if I would have listened to them, not only would it have wrecked my physical body and mind over time, but I may not have my younger son, So yeah, I mean, it's all worked out.
Well, thank you for sharing your story. And it's just amazing to me. We hear these things over and over again. And doctors should be ashamed of themselves. They really should. And then some of them question, it's like, well, I don't know why doctors are being less and less trusted now. Well, this is why. Why should we trust them? I mean, a good example is him or her checking your blood, finding some number and saying they need a drug for prevention when you feel great. Who cares what the number says?
Right.
You know, you changed your life by changing your lifestyle and your diet, and he or she wants to put you on a drug because they see some lab number. That just shows you how ignorant doctors are and how protocol medicine is done these days. Oh, you have this, we prescribe this. Don't worry about anything about the patient in front of you and saying how they feel. It's what the lab or the x-ray or the imaging says. That's how we treat patients.
Right, right. And it's similar with the way they treat the whole cholesterol issue too, is that if your cholesterol's over 200, boy, you need that statin, but they never tell you what are going to be the side effects of the statin long term, you know? And again, you know, people have the rights to make their own decisions when it comes to their health and what they put into their body. But I honestly do not, most people do not know the side effects of some of these medications that they're on. A lot of people think the medications cure you, they fix you. That's what they think. Yeah. And when I explain to them, no, you don't have your problems because you're deficient in a pharmaceutical medication. No. Like, we need to get to the root cause of what has created this issue. But, you know, people, they're scared. We should all hope that we could trust our doctors. I mean, I don't think that there's, you know, necessarily maniacal doctors out there wanting to hurt people, but, you know, they're trying not to lose their license. And unfortunately, the do no harm, I'm sorry, there's a lot of harm being done. And it's not that it's being done in, like I said, an evil, maniacal way. It's just the way that it is. You put some of these very high-powered drugs into someone's system, there's going to be a side effect eventually, sometimes immediately. So, and I'm not anti-medicine. I think that they can be life-saving. I think modern medicine can do miraculous things. Like I've always said, you know, if I'm in a car accident and I sever my arm, like, don't get my essential oils, get me to the emergency room and get me to, you know, a skilled surgeon. Like, of course, there's a place for it, but where they really fail miserably is in prevention. And that's what I try to do. I try to educate people so they can prevent the dysfunction, the disease, you know, and that's why I really try to do my very best to have people understand that there's a problem within them, that we should try lifestyle behavior modification techniques before. The medication will always be there. But maybe we should try to fix this in the most gentle way. But I can tell you, as someone who deals with a lot of people where they have to change their diet, food that is probably the hardest thing that people deal with. They do not want to change the way that they eat because, you know, sugar is a drug. It's an addictive drug, and it makes you feel good and gives you the warm fuzzies, and humans like sweet. You know, we instinctually, breast milk's very sweet for a reason, to get the baby to drink it and thrive. And so people don't realize that they're addicted to that. They think of addiction as drugs and alcohol. Yeah. They don't think of it as sugar. And so to try, and alcohol is another thing also, is a lot of people, especially women. I deal with a lot more women, to be honest, than men. But most women drink a lot of alcohol, and that creates a lot of hormonal dysregulation. They gain a lot of weight, especially in the midsection. They have depression issues or anxiety. And so what I have personally found as a holistic practitioner is that trying to get people to change what they eat and drink is the foundation of the program. That's the hardest thing. But as soon as people can start to feel the difference and to see how the weight usually comes off fairly easy if they're compliant and consistent, then that's very motivating. People can get behind it if they see results. But if they feel like they're deprived and the results are very slow because they're still trying to eat all their carbohydrates, that's one of the biggest battles that I face initially. But I think it's just human nature, and we're all a little different. Some people, they'll set their mind and they'll do whatever it takes. Other people, they have to dip their toe in and then go a little bit slower. I think because of my personal health journey, and I know what it's like to have to sacrifice and give up those things that brought me comfort and things I equated with love, like, the different traditional Italian foods and everything. And I'm a cook. I was a personal chef. I owned a company for 14 years. So I love to cook. And so it was a big lifestyle change. But whenever my stomach quit hurting, and then you learn how do you cook some of the things you like, but make them gluten-free. So I initially went the gluten-free route. And now I'm like, I don't do any of the grains because all the grains convert into sugar. And I'm 53 years old. I plan on being around a very long time. And I know that if I eat a high carbohydrate diet, that with my family history, it's going to make me predisposed to getting some of those degenerative diseases. And I just do not want to go down that path. Alzheimer's, I watched my grandfather, and then my dad's sister and his brother all passed away from Alzheimer's. And I just don't want my children to ever have to witness that with me. So, call it fear. I don't know. I want to be here functioning with my full mind and body for as long as possible.
Yeah. Well, I think one of the things I did a post the other day on Facebook, and I offered $100 for the first person that could name a disease, a chronic disease that is not affected by your diet, and alcohol was included because that's your diet. If you're drinking alcohol, that's part of your diet. Stephanie, I 200 and some comments on the post, and not one of them could think of a disease. They thought they had a disease that wasn't affected by diet, but then, when you respond with, oh no, alcohol affects that, or, carbohydrates affects that. I don't think there is a chronic disease that is not affected by diet. And it's like, it's kind of silly for us to think any different. Imagine that. We can cause a disease in our body by eating the wrong stuff. Imagine that. Well, duh.
Right. And I think if someone they're healthy, they're active, they don't have any chronic disease they're managing, and if they would like to enjoy some rice, some quinoa, some sweet potatoes on occasion, wonderful. But the problem is that people are eating mostly carbohydrates every single day.
Right.
And they're snacking all day long, usually on those high carbohydrate type foods. And their blood sugar's constantly elevated. And so, yes, I can't think of one disease that's not impacted by the way you eat, or how much good sleep you get, quality sleep, or you have to get enough sunshine. All of these, basically, as close to nature as we can live, the better. But us humans are very smart.
Right. And our sleep is affected by what we eat, by what we eat, how we eat, and drink, especially alcohol. And it's amazing. I had a doctor comment on the post, actually, and I'm not surprised, because this is the ignorance of doctors. and he was talking about a sleep disorder, not narcolepsy. He said it's not affected by alcohol. I mean, that is pure ignorance. You will prescribe a drug to treat narcolepsy, which the drug works in the brain, and you're telling me alcohol is not going to affect this disease of the brain? I don't know how to help you, doctor. I don't know how to help you.
Right. And also a lot of people like to hide behind genetics. You know, they blame genetics. Everything's just genetics. And yes, there are some of those very rare diseases that are just unfortunate. But the vast majority is, they say that, what's the adage, is that your genetics load the gun, but you know, pulling the trigger is your habit. So just because you're born with something that, you know, it's loaded, it might be there, but the way that you take care of yourself is going to determine if they express themselves, those genes, getting into epigenetics.
That's what we say all the time. And I blame doctors for telling people that, oh, it's genetic. That's all right. You know, diabetes runs in your family. It's just genetic. And most diseases, there's probably a genetic component. I'm of a fourth generation where my mom, my grandma, and my great grandma were all obese. That doesn't mean I have to be. I have been, but I want to change that. So I changed my habits. There's a difference between genetics and epigenetics. Epigenetics is our environment that we choose to be around and the things we choose to put in our bodies. And I think when a doctor labels a disease genetic, because in that post, there were a lot of them that says, well, it's genetic. Sure, it is genetic, but that doesn't mean alcohol is not going to affect the symptoms of that disease.
Right. Well, you're kind of asking for it. If you don't try to make the decisions that's going to give your body a fighting chance, I mean, it's kind of like you're just tempting fate, you know? And so in my mind, I'm like, listen, none of us, we could all have the best intentions, and I am not so bold or ignorant to sit here and tell you I will never end up debilitated. I will never get cancer. I will never, because we don't know. No. But we can make decisions that will make it more unlikely that we will get that type of a chronic inflammatory type disease. I mean, I would like to think that, you know, while there is nothing is 100% certain, you know, having chronically high blood sugar and having a damaged liver and being physically weak because you don't move, you know, you have to at least be able to get yourself up and down off of the ground. You know, I call that, as a yoga teacher, I tell people, you don't need to bench press 200 pounds to be called strong and healthy. You know, I'm in this for longevity. I want to be able to move my body weight freely up and down steps, get up and down off of the floor. I want to be able to reach up and extend to get something off of a shelf. You know, being able to do a couple push-ups, not a bad thing. You have to squat. You have to squat. You have to have really good posture. You have to breathe deeply and inflate the whole of the lungs. That's something I didn't know until I went into yoga teacher training, is that we just don't breathe correctly. Like when you inhale, most people, they get up high in the chest. Inhale and you like suck in your gut and all the air is up high. In a proper inhale, the belly expands out. And as you exhale, it pulls back in. I think in our society, and maybe Janet can agree with me on this, but especially as a woman, I mean, my mom used to put me up against the wall and tell me to straighten up and hold in your gut. And, you know, like, so everything was just totally wrong, you know, and people just don't know better. And so I think that a lot of times anxiety is brought about because people don't breathe properly, or they quit. As we get anxious or scared, we tighten up, we hold our breath, and it gets very shallow. And so, you know, I think if people just had some basic information about, in Kundalini yoga tradition, they called the physical body is technology. activating, using the physical body and its technology with the nervous system, central nervous system, periphery, the lungs, the different breathing, pranayama techniques. That's how we work out. We work out our mental stuff through the physical body. And I always thought that was really kind of profound, the way that they looked at our physical body and just how incredible it is, but we've never been taught how to use it properly. So, there's different breathing techniques that impact the brain, and keeping the body strong. A strong core doesn't just mean your abdominals, it's the whole girdle area around the body. It's your back and your belly. It's everything that has to be strong. And so, nutrition is high. I think that's the number one thing that we can do to try to prevent illness. But then you have to use your physical body, because when the physical body is strong enough to move you through time and space with ease, hopefully, that is just going to make the quality of your life so much better. But like I said, humans are smart. Technology, while wonderful, we don't have to be as physical now. Mm-mm. And so people just have kind of gotten weaker. And so again, as part of the education, as I tell people, I'm not telling you to go train for a marathon, bench press 200 pounds, run on the treadmill 10 miles a day. No, I like the yoga because it takes care of everything. And there's different styles, of course. Some is a lot more demanding than others. But yeah, being able to move your body freely, hopefully without pain and discomfort, that's kind of the goal. And if you're eating in a way that's not inflaming you, that should make it all the more possible.
That's right. So Zoe, go ahead and stream her website. So you have a yoga studio, correct? You're going to teach yoga after this, aren't you?
I don't own the studio. I teach at two different studios, actually, in the Tampa Bay area. I'm at Karma Yoga and Fitness, and I'm also at the Yoga House. And I teach roughly about 8 classes on schedule a week. And then I do workshops and teacher trainings in addition to that. And yes, I do. I teach tonight at 5:30, and I've been doing it for a long time. I've been officially as a trained teacher. I mean, I don't know what the rules are, but when I started teaching, 10 plus years ago, you did not have to be certified to teach yoga. But most reputable yoga studios want their teachers to be trained and certified officially, and be certified through Yoga Alliance. That's the most common kind of governing body. And so I love both studios, and I try to maintain my own practice as well, because teaching and taking as a student are two totally different things. That's right. As a teacher, you're more mindful of what's going on with everybody in the class, and you can't really focus on what you're demonstrating. It's more like you're a demonstrator, but you're not putting your mind focus and really breathing with the movements. So I had found that for a while there, I was teaching so much that my personal practice started to suffer. And so for my 50th birthday, I said, you know what, this is crazy. I'm getting away from the thing that I love the most, And so I have been really committed to not only taking my own yoga practices, but I also do spin class, and I do some Pilates and, a little bit of everything, a little bit of weightlifting, because, maintaining your muscle mass, especially as you get older, is really important. And knowing that the amount of muscle mass that you have is part of your metabolic system, and I want to be able to burn glucose properly. And the more muscle you have, the more likely you can control your blood sugar.
Absolutely. Well, boy, Stephanie, you have been a wonderful wealth of knowledge. Thank you so much for helping us realize our goal of this podcast, which is to educate and empower individuals to take charge of their own health. So I really appreciate it. Thank you.
Oh, it's been my pleasure. Thank you.
You're welcome. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Wednesday because of Christmas, Wednesday morning, 8 a.m. to 9 a.m. Pacific Standard Time for our midweek podcast. And we thank you all for tuning in. Thank you.